Much for coming out. My background started out in critical care and then worked in the burn unit, which was pretty hard watching young kiddies going through a lot of pain. So you had to get up to speed with your counseling skills. I also worked oncology, and I found as I went through, so with cancers, I really needed a good grasp of medical and psychological, because they're not apart. They are together, even though sometimes we treat them as they're apart. I landed in the ADHD clinic with Susan and absolutely loved it. Worked research first and ran the clinic for about 10 years. And then the last 2 years have been in private practice. For the ADHD, I found out through serendipity that I have 3 ADHD children. And so not only do I work in the field, I have a household that's extremely chaotic. It's a lot of fun, but I don't get depleted, my poor husband does. Partly because I'm the genetic side for the ADHD. My dad is full on, so it's quite cute. My dad's 88 right now. He's still going on, but we thought he might have a bit of senility coming on, and we realized, no, it's just his ADHD. It's way worse. He's still sharp as a tack. So with aging, your ADHD does get worse. So without further ado, what we're looking at today is we're going to start out with neurobiology. We often forget it's a brain thing. We're looking at triggers, mindfulness, reframing, coping, and then strategies, coping strategies actually. For my population here, I wasn't too sure who was coming. How many here are for parenting needs? If you could give me a show of hands. How many people are for their own needs? And how many people are here for spouses or significant others? It's usually a gamut. As I said, it is very genetic, so often you might have it, a family member might have it, a spouse might have it, and you might be blessed with all these children having it. And I do look at it as a blessing, but you have to learn how to cope with it. So when we're looking at the core symptoms of ADHD, right now all of this will change as of next year. And the DSM-5 is coming out, and that's kind of the medical model for psychiatrists and how they frame mental health disorders. Right now this is the DSM-4, it came out in 1994. Much of it will still be the same, except they're going to try and correct deficits that we have found because it's more a child focus. The DSM-5 will be including more adults. So the types we have of inattention and distractibility for ADHD, we have hyperactivity, and we have this third type, impulsivity. But truth, those are all the kind of core symptoms. And how those core symptoms are relayed are types of ADD, that's the ADHD primary inattentive type, the ADHD primary hyperactive, and then there's the combined, which is inattentive plus hyperactive. We're finding that very few people just have hyperactive, and I'll get into that as we go along a little bit. So when you're looking at attention, here's the symptoms that we're looking at for inattention. It's hard to sustain attention. You can focus all you want if you like it, but it's very hard to sustain it if you dislike it, or if you come to an area that's no longer fun to do. So for adults that are doing a big project, they're usually really good at getting going and then getting into it, getting organized around it, but they're not going to send off all those little emails. They don't finish it off as they get more and more of it done. They find something else that's more fun and move on to it. So it's hard. Don't listen. They often do listen. They look like they're in a different world and they've listened completely. Then other times you think they're listening and their brain has gone somewhere else completely and they have no idea. And that usually happens in large classes in school. They get a little bit bored, get a bit distracted, they're off on another thought, they come back and they have no idea what the lecture's been about for young adulthood and university or all the way through school. It also happens with our adults. When I was working at Children's, we did these one-day workshops Sue and I established, and it was for parenting. But what was interesting is half of our population, the parents, were outside roaming. And we actually started just putting the speakers to the outside instead of in the auditorium. They couldn't sit. And these were all adults, high functioning, low functioning, you name it, all different careers. But they couldn't stay for an 8-hour day. It was nuts. And so they needed to move, they needed to take those breaks. So with adults in board meetings, things like this, if it's not interactive, and longer than an hour, kind of zone out a bit. Not follow through, I talked about, can't organize. They can organize, but it's very disorganized, and if you try to do linear organization, it's not going to work. So that linear organization is usually all the systems where you put everything away, and it's all alphabetized. It doesn't often work. You need visual cues for ADHD, and so as soon as it's put away in a drawer, it's gone. It's done. So you can organize, but you need to adjust how you organize. Losing important items, yes, all the time. Doesn't matter where you are in the lifespan, you lose stuff. What happens though as an adult, you get really good at finding things. When I do my initial assessment, my favorite guy, he was 23, I asked him if he loses things. He goes, no. I said, oh, come on, you must lose keys. Everyone loses keys. No, I have 20 pairs cut. He said, burglars might find them. That might be a down issue, but I don't lose them. I can always find them. Easily distractible and forgetful always occurs. So when we look at the difficulty, how this manifests later on, as I said, adults get coping mechanisms, young adults do. You still stay disorganized, have really poor time management. But I'm finding when I'm working with my adults, what the biggest one is the procrastination. It's often paralyzing. Once they sit down, it might be 11 o'clock at night and they're up till 4 in the morning to try and hit the deadline. They hit all the deadlines, but they're very dysregulated. And that's kind of a hallmark. When we look at impulsivity, the little kids blurt out answers, can't wait their turn. Often you get very upset with kids because they always seem to be rude and interrupting. It's not that. They can't hold it in mind. And what's happening is they're frightened they're going to lose the thought. So they're going to interrupt you to get it in there. And it's really just, for some parents, they think they're being really rude, but it's not. They're just so frightened that they're going to miss the information. And the impulse control, too, is there. What happens when we see it for adult manifestation, you can still get that blurting out answers and can't waiting the turn, and it comes up usually when an adult gets triggered. So if you're in a meeting and the boss tells you you need to do this, and you don't want to do it, and you get triggered, you will impulsively blurt out something. And you might, as my dad did, I remember when we were in Winnipeg, and he's in charge of 12 branches, and he told the boss basically that he was a fool. And the next thing I know, we were in Regina in one branch. And we were there for 2 years until Dad had done his penance, and then also off we went again. But, you know, that quick impulse, and it's like, oh, why did I do that? How did that come out? So you see that. For teens and adults, that restlessness, there's an inner restlessness you get with it. You can often see that going into smoking, caffeine, drugs, impulsivity. My favorite 23-year-old again, he stole a car. I asked him why he stole a car. He never got caught. He said the car was running. I was 14. I really wanted to drive. I didn't even think. I got in the car and I drove away. And then I realized I've just stolen a car and I don't know how to drive. Crashed the car and I ran away. But he was a good kid. He got in the car, he's going like, how did I do this? What am I doing? So there's impulse control for young adulthood, and it happens all the way through. When you see the pregnancies, STDs, shopping, that's all about not being able to control your impulses and not planning. Let's say you're having a night where you plan to be romantic or whatever, and you've forgotten your birth control pills. Forgetting birth control pills is a huge one for unwanted pregnancies. Not controlling alcohol, substance abuse can lead you into more risk-taking activities, and you end up in the next morning in someone's bed and have no idea. The same 23-year-old, I asked him if he had problems with alcohol and drinking. He said no, and I asked him if he'd ever woken up in the morning with someone he didn't know, and he goes, all the time. He was enjoying life, but he said sometimes you just wanted to get out there so fast and you had no idea what was happening. So the emotional reactivity, for sure, that's again not being able to control your impulses, but it's also more than that. It's also when you're, especially as a youth, when you're constantly doing things wrong, and you're constantly told you're doing things wrong, you have two ways to go, in my mind. And that is to be oppositional and tell everyone to go away, or to go inner and get anxious and sad. And I think most of my little boys tell people to go away, and they can get really oppositional. But that being said, I have 3 girls, and my youngest is so oppositional, it's wild. but we can tease her. We can pull her out, and she's pretty good. But that's emotional reactivity. That's an sensitivity. You get tired of doing things wrong. Hyperactivity, it's not always all over the place for kids climbing, doing all that stuff. It's also that verbal chat. Some kids don't stop talking. That's my youngest again, does not stop talking. I ask her to breathe. Sometimes she'll start laughing because it's kind of our code word that she's maybe been talking too long. Not settled, driven by a motor, on the go. When you're looking at it to adult, speeding, self-medicating, usually with marijuana. Since we're in BC, marijuana is one of our favorite self-medications, but also cocaine, E. You get into a whole bunch of stuff as a young adult. And even, well, when we did our study for alcohol abuse, we found that most of our male adults, 50 and under, were using marijuana at night to go to sleep, because sleep was a real issue. And what happens is it makes your inattention and focusing ability 3 times as bad. And when we're looking at overall results, our addiction issues are 3 times, untreated ADHD is about 3-fold higher than the normal population. Now, when I'm talking about treatment, I don't just talk about medications. In this whole slide point, actually, you'll find I haven't even mentioned meds. That's another talk, completely. So my viewpoint is you can try meds, try not meds, but what can we do just to help you without medications? I believe in meds. Only one of my children can take meds. The other 2 can't. So it's probably why I have a firmer stance in you need more strategies than just medications. But medications are brilliant when they work. They're amazing. I promised my 17-year-old I would tell everyone that because she was failing and now she's straight A's. So in 2 years. So I always promise her. So we've kind of gone through kind of the symptom checklist, but here it is in real presentation. You've got difficulty finishing daily jobs, family problems, relationship challenge, loads of the marriages are on the rock, there's reactivity, they've gotten into fights with bosses, they've lost jobs, they're in an undergrad program for 10 years because they keep on switching what their major is going to be. It's hard because it's like, oh, I'm going to do this, and oh no, I'm bored of that, I'll do this. So I find a lot of that at university. You're always under potential, always. And this is talking about adults, but it actually works right through the lifespan. It works for everyone. Low frustration tolerance, again, I think that's a symptom of self-esteem. I think it's a symptom of impulsivity, reactiveness, but I think underlying it all is self-esteem, sadness, and anger, just because you get tired of being told you're not doing things right, and you get frustrated with yourself. So we went through the subtypes before, but what we're looking as clinicians, how do we differentiate? Because everyone, if you look at this, has a smattering of all these symptoms. It's what we have to look at is impairment level. And so what we look at for the DSM-4 is you have a 9-symptom checklist. You need 6 of those symptoms for inattention. And if you have a smattering of hyperactive, then you'd be primary inattentive, or ADD. The hyperactive impulsive type, you would need 6 of just hyper. We don't find that very often. We find it in very smart kids that we're testing them developmentally when it hasn't showed up yet. And that often happens with kids that do a lot of sports and things are controlled with sports. They get an injury and all of a sudden you see the ADHD full time for that hyperactivity. But hyperactivity alone is more from the States, and it's more from preschool, 3 and 4 and 5. That's where you see it often. We don't treat kids under 5. In the States they do with medication. So some of it is a little bit from that influence. Mostly what we see though is the ADD, that primary inattentive, or the combined type. In the combined type you need 6 out of 9 symptoms for inattentive and 6 for hyper. And you have to show these symptoms for impairment before the age of 7. And that's what's really changed. In the DSM-5, they're going to be looking at, if you are inattentive, that you have to show the symptoms before 17. We're finding kids that are very bright and just able to breeze through school. Sometimes they don't show up until grade 10. They don't show up until the academics are really hard. University students, so sometimes they've breezed through all of high school. all in elementary school, and all of a sudden they're in university, they have to juggle the activities of daily life, but the academia is really hard. And for the first time, they can't get organized, they can't pay attention, anxiety is going up, and often they get diagnosed with anxiety. But if you start taking history, you start seeing, no, that they've been inattentive, they've lost stuff, but they were really bright and they could handle the academic challenges. And the only time it really gets in your way as a kid, if you don't have the reactivity and the oppositionality, is with school, not being able to do school. So they're changing that, and with ADHD, that hyperactive and inattentive, they're looking at 12. Again, that's high-functioning, really bright kids that maybe do a lot of sports. And again, 12, you're looking about grade 5, grade 6, when all of a sudden academia is getting harder, right? So it starts to present itself. So when we're looking at the brain is actually different for ADHD. That's why we call it developmental and neurobiology, also very genetic. And so with the brain, the frontal cortex, that's this part right here, a lot of that's affect. The head of the caudate nucleus is actually larger on one side, and in most people with the non-ADHD. And ADHD people, they're the same, and they're smaller. The frontal cortex is smaller and the lining is thinner. We're finding that there's a whole theory about that the brain is just developmentally lagging a bit. It's more set up for destructibility, and as they get to about 21, 22, it matures a little bit. And that certainly does fit with a lot of our adolescents that all of a sudden seem to not have ADHD into adulthood. All of a sudden they seem to have coping strategies, they seem to be getting along. And what the theory is the brain has actually grown enough that it's working well. The next picture is a really fun picture. The one with all the red is a non-ADHD brain. This is an ADHD brain. And they've been asked to do a Stroop test. A Stroop test is simply a test that does a lot of working memory. So you've got a big picture and it says red, but it's colored blue, and then kind of little Venn diagrams in the back that are all these different colors. And so the mind is saying, they're saying, what's red? Or show me, what does the word say? And you might say red because it's color red, even though the word says blue. Right? So you have to really kind of look at it, put it into your brain, map it around, and spit it out. That's really hard for some ADHD people because working memory can be quite impaired with ADHD. So when they took the pictures, all of this red activity is not efficient firing, whereas this brain is working double time. So what they're thinking with this, it's just not firing in the right areas. It's fighting, their whole theory about ADHD is that they were the hunters. They didn't need to sit down and really concentrate and look. In fact, they needed to move, they needed to be distracted, and that they had to pick up, a deer coming from behind them, stuff like that. That's the theory anyway. So what we find is when the kids are on medicine, their brain looks more like this. So before we get into the common life challenges, I talked about the genetics. ADHD is as inheritable as height. It's a multi-allele, so there's 5 or 6 genes that are used in it, and that's why you get such a different presentation even in one family. So I've talked about my 3 girls, and we have a primary inattentive ADHD girl in the middle with some real learning disabilities, and she's had some neuro insults too from an early age from chickenpox. Our oldest is full-on ADHD combined type, but didn't really show up the combined type until we had to do psych ed testing, and she couldn't sit still for the whole testing. It's almost a whole day, and she's up sliding all over the floor and doing stuff, and you realized, and also when she got injured, because she's full-on sports. She's now 22, gone through university and now working and doing fabulous, but definitely had some struggles in elementary school. And then my youngest one is ADHD combined type, some generalized anxiety and oppositional. And so she's the brightest of the 3, but she has the most impairment of the 3. And so when you're looking, just to know that genetic, what happens with all those kids is they've got different genes from each parent. So you can have sub-threshold parents on either side not showing any signs of ADHD. They meet their love of their life, and the last thing you're going to ask when you're interested in someone is, do you have ADHD? Do you have mental health? And you don't do that. It's just, we're not trained to do that. And so what happens is you can get these very functioning parents with very wild, chaotic kids. So when we look at common life challenges, you'll notice that there's a kind of a frame all the way through. For youth and teen, they're pretty well the same, except for the teen, you're started getting in drug abuse, alcohol, risky behavior, sneaking out, sleep, nutrition, addictions. And with all that going on, you can also start getting that comorbid health. They get defeated, they get anxious, their environment's hard to know, and they can get very sad, and all that combined. And for the youth, you've got more of a developmental lag. These kids are usually operating developmentally about 2 years behind. So you've got a kid that's interested in world peace, and they're grade 4. They're interested in world peace, but they're still playing stuff with kids in grade 2, not with their peers. Their peers think that, what on earth? I'm worried about Justin Bieber, and she's talking about world peace and she thinks Justin Bieber is stupid, and then she's out playing swords with the grade 2s. Right? So it just doesn't fit in, so there is that lag. And also with the developmental lag, you'll see sleep issues. Often they have a short clock. ADHD people often don't need a lot of sleep. It's dysregulated. They can go to bed at 2 and still be up at 6 and still functioning. Or else they often get to a night routine where they're up quite late and they need to sleep in. But there is a dysregulated sleep pattern. With computers, the advent of computers, we're seeing a lot more addictions, more so than drug and alcohol even is with computers. I'm seeing kids fail first-year university because they are online all night playing games. They're on all night playing silly games even, just like shoot 'em up games all by themselves. It's avoiding something else. It's procrastination. But the computer is easy. It's like brain candy. It fits. When you think about how distracted you can be on a computer, it's awesome. It makes it easy. I can check my emails. I can go off and see this site. I can look at YouTube. I can look at trailers. You can do so much instead of just sitting down and doing a paper, right, for school. So, and also with our young kids, we need them to be quiet, we need them to sit still, and we give them a computer game. And I think that's fine, I really do, but you have to just monitor how much time they use. With adults, again, you have the school, friendship, but what I don't have in there is work. And you can be like my father, and that impulsivity, and we traveled quite a bit because of his impulsivity. He's a great man, smart man, and we always kind of got back on board again, but I've seen a lot of Canada. From a young kid. School, work, friendships, addictions, and more than just friendships with adults, it's relationships. Often it's hard to be around with a person that's always procrastinating, that's always losing things, that always forgets important meetings, that's always making mistakes. I'm really well renowned for reading my emails wrong when I'm doing sports for kids. Work is fine, but sports for the kids will be at the wrong place, an hour early, half an hour late. My husband refuses to take any directions from me now. He checks the emails first. He'll be out in Abbotsford instead of Burnaby, stuff like that. So, but often is hard to live with as a spouse. The comorbid health, again, anxiety and depression. Anxiety, well, we'll get to that, you'll see it. So when I talk about dysregulation and focus, so it's not that you can't attend, it's that you can't stay regulated. I think I've discussed that already. You can focus brilliantly for hours on one thing, but it might not be the thing you're supposed to be focusing on. If you like it, it's great. Sleep, it's not just attention. Dysregulation can be with sleep, nutrition, exercise. ADLs are activity of daily life. I was joking with this parents came in, I said, well, you have to start where your kid's at. And I said, what's the biggest behavior you want to get changed? And he said, brushing your teeth, the dental bills are going to mount up, and that's what I really want to work with. And he had ADHD, and everyone knew he had ADHD. I said, well, what would you like to do with? What was your biggest problem? She started laughing, brushing my teeth. And he said, it's weird, because if he gets out of his morning routine, he'll find out he's in the car, and he's forgotten to brush his teeth. And his child is still learning morning routines and is all over the place. So what happens is that's an activity of daily life. And often if you don't have set routines, they're very hard. Your mood, that unpredictability, that reactability. As an adult, it can be irritability plus that impulse control. It's often the guy you see jumping out of a car ready just to yell at someone because they almost hit them. He didn't mean to be there, he's a good person, but he's impulsively reacted to rage. Or you've asked the wrong question of your child, they take it as an insult, and next thing you know, your head is gone, like they've just taken your head off. It's, all you said was good morning. So it could be many things. It's just that reactivity. Also, you're almost always under potential. It's very hard with all this set of things to work towards your potential unless you're finding a career, a subject that is really suited to you. And not everyone is that fortunate. But if you can find a career that you excel in, that you take off, like we have airplane pilots. I know everyone gets nervous about that, but they can really multitask and really focus. They make some of the best airplane pilots going. We have people, race car drivers, they don't take their meds for the race car driver because they second guess them, but they need it for meetings, all that stuff. We've got pro sport, we have this is a cute story. I had a snowboarder, he's a pro snowboarder, and he tried meds because he's going back to school and he was failing miserably, couldn't attend, very restricted. So he put on the meds. He thought he'd try them for his sport. And I get this call, Kath, how long does this stuff last for? I said, oh, you're long acting, it takes about 12 hours. He goes, oh, okay. And so I'm going to put off the race or something. I said, what's happening is I'm standing at the top of the cliff, had to do this amazing thing. I just said, am I nuts? Am I crazy? For the first time, stopped and looked at what he was doing and went, oh my God. So the next day he was drug-free and right back to normal. It was so cute. He was thinking, how long do I have to do this for? So as I said, people can focus better if they're interested, if they're task-oriented. So you give an ADHD a person a task that has a start, a middle, and an end, and have 5 days to do it in, they're their person. It'll all get done, it'll be creative, it'll be lovely. You give them a task like, let's do the web page, 2 years later, it's too open. So you need something really task-oriented. Routine and structure really help. For little kids, that's hard because you've got to build that in. I use my 22-year-old as a great example. She knew sort of how to cook without burning the house down by about 15, and it was really limited. She could make grilled cheese sandwich, mac and cheese, scrambled eggs. Yeah, that's about it. Toast. Open up a can and heat it. Still wasn't doing her own laundry, cleaning up. Oh my goodness, a bomb went off. But for me, her main job was school. That's what I was really going to do well in school. Let's get that regulated and do sports because that helps you. That's kind of where we went. First year university, she went away. She never had a computer working all year, never did any laundry. She's celiac, had no special diet implemented. She came home quite sick, but she got through the year. She had 4 A's and a D. Quite oppositional. She wasn't going to drop courses. So the 4 A's were brilliant, all the courses she wanted. D was English. She didn't read the fine print. It was online. She thought she just had to go and write an essay, which was only worth 40% of the mark. And the teacher, she's a small university, thank goodness, took pity on her and just passed her. And if she'd been UBC, she would have failed, no doubt. So the routine instructor helps. By fast forward to end of the year, she's doing laundry, she's got a computer that's working, she's doing resumes, got a job, she's done a double major and graduated with distinction. She's found something she loved. All the D's she got the first year were statistics and the English. She retook them. On a short, she figured it out. She took it and she got straight A's in them. So that was good. But it took her 4 years to get those activities of daily living. And so if anyone has kids or you're in university yourself, know it'll all come. You just have to be persistent and work on it. And routine and structure really help. So as I said, it's more challenging to negotiate life. You have to remember it's a developmental condition, all the way from child to young adult. That's that smaller brain kind of catching up. You have difficult regulating, so it's a dysregulation of emotion, mood, and that spirited temperament. That's a nice way to say stubborn or oppositional. You have problems with dynamics and relationships, and those dynamics start when you're a kid. And often the way things happen, they become not just a dynamic or a pattern of you trying to cope, they become a habit. so that you carry them on into adulthood, which causes you more issues, let's say, in work, school, or with your significant other. There's often real challenges with learning and communication. And my middle one is really, they were going to modify her. She wasn't going to graduate. And that's why she always tells me she started taking Adderall. Took many tries for different meds because she couldn't take them easily. And as I said, she's now functioning. Grade 12 is harder for her this year, but she'll be able to get on to some type of post-secondary education, which is good. But given time or severity, if it's untreated, you're not aware of it, you're not making any advances, almost all of my adults go into anxiety, depression, alcohol abuse, substance abuse. So that's what this next one is. This is what the comorbidity, a fancy way of ADHD plus. So some people, because you can't make sense of your environment, you can't attend, it gets overwhelming, and you get anxious. So some of it is caused from ADHD, but ADHD is not the only genetic disorder. You might have ADHD and anxiety. It might not be the cause of ADHD, and sometimes it's hard to suss that out. So in our clinic, what we found is when we tried treatments, we'd start out with really low doses of stimulants. I like stimulants, they're in and out of the body. And if the anxiety actually went down, we knew it was a thing about not getting overwhelmed because you couldn't pay attention, you couldn't focus. And so that's a great treatment. If it's anxiety plus ADHD, you have more problems because some of the medications make the anxiety go through the roof. And so most things that work is cognitive behavior therapy for anxiety. So therefore, then you have really low dose of stimulants, maybe some other meds, and then you'll start working with reframing, a lot of the tools you'll see as we go through for anxiety. But here you've got, as you can see, I talked about that untreated. In kids and adolescents, you've got 40% with ODD and 34% anxiety. And you look over this GAD, sorry for all the acronyms, I couldn't get in to change this one. This GID is Generalized Anxiety Disorder, and it's gone up from 34 to 53. So that's not the development of anxiety disorder, well it is maybe per se, but that's untreated ADHD. And often when you look at it, loads of people start taking treatments for generalized anxiety, but they're not realizing the underlying issue might be ADHD. And so it's missed easily. If you don't look, if you don't pay attention to ADHD, you'll miss it. Especially because there's such a wide spectrum with gene lookout. So where do we start? So where I love to start is triggers. Everyone gets triggered. That's that, like my dad getting mad at the boss, definitely a trigger. Parents get triggered when their kids are yelling back at them, when the kids are failing, lying, sneaking out, whatever they're doing. When their spouse is mad at them, when their significant other has just had enough and needs a break, and you're kind of left standing alone, and you get triggered, and you get sad. So the thing about triggers are they're kind of cool. They're cyclic. We know what triggers us, usually. If you sit down and take some time to figure it out. I know I get triggered when someone speaks to me really rudely. I know I get triggered when I'm tired. And I know I get triggered when I'm late. And I know absolutely. And when you know what is doing it, you have to start looking at when. When does it happen? When I'm late, it's because I've probably not managed my time organization very well at all. And I've thought something will take 3 hours and it's 8 hours. And I haven't built in a schedule, right, to assist me. It might happen every day I get home at 3 because the kids are in and I haven't had a switch from work to home, and I've got all this chaos coming at me. And people are yelling at me because their needs haven't been met or day hasn't gone well at school. And then I have to just step back and know. The good thing about this, when it happens and why, is you can prepare yourself then. And if you're aware and you can prepare yourself, it's amazing, you don't get triggered. And one of the things that really helps is what we call mindfulness. And we'll go through all these. So mindfulness is from a Buddhist thought. It's something we've used for a long time. Actually, I think Morita therapy was one of the first things to ever use in Japan to put it to psychological. But so all of this, what triggers you, mindfulness, your perspective on life, your communication abilities, where you are neurodevelopmentally, and what strategies you use really affect how you start and where to start. So let's have a look at these. So as I said, they're usually cyclic, they're environmental. Usually triggers are based on what you've been raised, and often when you're co-parenting from a parenting perspective, you have very different beliefs. I'll use our family. My husband really believes you just get it done, you move on, and off you go. And my belief is, no, life is never that straightforward. It's because of my dad, right? I've seen that. And you have to be a bit more flexible, you have to be a bit more creative. Well, when you've got two different parenting styles, as everyone does when they're parenting, you get into fights. And the kids love it because it's no longer about them. Parents are going at it. So kids get really good at divide and conquer. They're really good at it. When also, it's not just with parenting, but with, let's say my boss comes in and is really disrespectful to me, hasn't asked how my day is, just walks in and demands these charts. My back would get up. It's like, no, you have to have some basic civility. That's how I've been raised. You're not rude. He's not being rude, he's being efficient, he sees me every day, right? So it's a different perspective of how you've been brought up, the values you have affect how you get a bit snarly inside, or how you get maybe a bit sad inside. When you get triggered with anger, it's usually sadness, shame, those are the things that bring it on. When you're looking at unrealistic expectations, when you get triggered, is that your child might not be able to do something you've asked them to do. You've asked a 14-year-old to brush their teeth. They should be able to brush their teeth, but they can't, and it triggers you. But developmentally, they're behind. And your expectations aren't realistic. Same as I've got some adults I'm dealing with right now that are way over their head. They got a promotion, they thought they could handle it, but don't know how to go to their boss to say, we're way over our head. And they're getting triggered emotionally and having a really hard time carrying on or dealing with discussing it with their boss to get some changes. So he had unrealistic expectations of himself of what he could do. Mindfulness of these triggers, as I said, if you know about it, you can really help diffuse it. You can use self-talk, things like stay calm. I can help the person learn better. I can learn better. I've heard this before. It must be real. Don't react to it. Just calm down and look at it. Don't be stubborn. So you can do this self-talk and change your negative loop. Then self-talk is extremely strong. Mindfulness is extremely powerful. So approaches, always stay calm, consistent, and immediate. You're getting triggered, just know you're going to get triggered. Usually when I know I'm coming home and I'm going to get a deluge of people, it's like, no, just relax, take a couple of deep breaths, which is very much a mindfulness practice. Model respect. If I trust someone, if I'm respectful to someone, the people will be, it's really, really hard to get angry and yell at a person that's being kind to you. It's very hard in any environment, be it parenting, work, school. And there's ways that even if they are getting mad at you, you can turn them around. It's just positive reinforcement. For parenting, you need to provide structured choices when you're getting triggered. Instead of, you didn't pick up the toys like I told you to, it's choices, you can pick up the toys now, or let's say in 10 minutes if you're having a tough time, but they do have to get picked up and you need to pick up 3. So really, really clear. That's with a little kid. Catch them doing it right. Often it's like you didn't clean it up, but they hung up their bag, they went through their bag, they did their homework, and all we see is what they did not do. And that's what reads into this reactivity, this ability to snap a person's head off when you've asked them good morning. Because usually good morning is, good morning, gotta get up, and did you get all your paperwork done? And it's like, I should have just stopped with good morning. Right? So you have to catch them doing it right. Redirect behavior, especially with little kids, or anyone actually, really. If they're doing something you don't want, you can stop them and say, no, you misunderstood, this is what I need to do, instead of yelling. We often tend to yell, you didn't listen, and it's easy to say, oh, I said 3 toys, you picked up 10, but we still need to move on, or you didn't pick up any, but you cleaned your coat. So just make sure with kids to stay on top and redirect. For you yourself, you can do this too often for an adult, is you need to reframe to positive. So you could be on a negative cycle, you're getting triggered, and you need to stop that negative talk. Example, my husband comes home, I've been waiting for him all day, comes home, says hi to everyone, and I'm about to ask him to take over because I need to do something, and I see him going out on his bicycle. And I want to kill him. And my self-talk is, that bugger, I'm going to kill him. That's my self-talk. How dare he, right? You do the whole thing. And all of a sudden it's like, oh, no, is this helpful? So you have to be able to stop that self-talk. Is that helpful? No. The poor man's going to come back and going to take his head off. Maybe he had just a horrendous day, right? And so this was way back in our marriage when he was doing this. And what was happening, he had a lot of stressors at work. And I didn't ask him why he was doing it. He just started doing this. And all I knew is, I need a break. I've been waiting for you and you're not here. So I didn't communicate that. I just got angry. You're taken off. And so when I asked him about it, I said, you know, this is a problem. It's like, oh, no, I'm going to be a horrible parent. I'm going to take all these children's head off. You're so much better. I didn't know it was a real issue with you. Give me an hour, I'll be back, and then you're free. Come back at dinner time, I'll make you a meal. Right? So that just took open communication and not jumping to assumptions. But when I got myself going this, it's like, no, probably had a tough day. So you stop that negative cycle that's going to build you up to react. I told this kid not to do this 500 times, right? And they're doing it still. And that type of self-talk is just going to send you through. For an adult, also, a lot of it, you can change your environment. I've got one adult that is really not dealing very well with his boy, and his boy's only home for kind of a 2-hour exchange, then he has to go from school to work, and in that 2 hours, all hell is happening in the house. They're fighting like mad. So I told the dad he can't do anything right now. His boy's trying to do the best he can. He needs to change his environment. So he has it that the boy comes home, he's there for 10 minutes to say hi, and then he goes and works out. And he gets rid of the steam and the release of tension. And he's aware now, and they're not fighting anymore. And when you're not fighting, your kids will come to you going, Dad, I'm having a hard time. But when you're fighting, there's no way that communication is going to be open. So mindfulness, as I said, it comes from Buddhism. It involves bringing one's complete attention to the present experience on a moment-to-moment basis. We often use it with eating disorders, that kids can't just sit down, or adults can't just sit down and scarf a meal. They have to sit down, prepare it, and they actually have to sit down. They just don't grab stuff and go. They don't do mindless eating. I have one fellow, when he's upset or anxious, he'll go by and buy a bag of chips, and he eats them while he's in the car. Or his sugars are getting low, so he'll buy Smarties. And next thing you know, he's been eating and had no idea. But when he stops and really thinks about what he's doing, he's able to stop the bad snacking. He's able to sit and really enjoy his meal. He's eating way less. And a lot of the eating disorder that he was developing is gone. So that's from a mindfulness. That's just an example. But it works really well with ADHD because you're paying attention in a particular way on purpose, in the present, and not judgmentally. And so it's really task-oriented too. Let's say I'm going to come down and I'm going to do a portion of my website. I'm using website because it's a big project. Most ADHD people have a horrible time doing them, even if they're tech-oriented. And so I'm going to sit down for the next hour and work on an introduction. That's all I'm doing. I'm not thinking website, I'm thinking introduction. I look at my time, I think about everything I need to do, I think of my day, how it's been, I do some deep breathing, look at the clock, sit down and do it. And that type of mindfulness with the task orientation really works. It's amazing, you just get going. The other part is just being open and kind of acknowledging, accepting as it is. The Buddhism uses it as the way. And for oppositional kids with ADHD, that really helps because it's like, you know what, there's so much we don't have control on. There's no use pushing back all the time because it's not going to help you. Sometimes you have to just remain open. And a lot of deep breathing and meditation is used for this. If you can do yoga, fine. I'm finding most ADHD people hate yoga. I love yoga. Maybe the inattentive people do well, but really active people hate it. They hate it. They're falling asleep or just, they got to move. And so we came up with a way of using mindfulness kind of 3 times a day that really helps get centered in the whole world, but also using it before tasks. And that's the self-regulation for immediate experience that I talked about. We're going to do this one portion of the website, sit down and do it. We're going to stay committed to doing this behavior for this one child. I have one behavior I want to change. I'm going to stay committed to it. And I'm going to think about everything that we need for this one behavior. And committed for ADHD usually means 6 weeks for a behavior change. It's not like a 2-week thing. It's longer with these kids. But you're taking a mindfulness that's all I'm going to work on. I'm not going to work on getting ready in the morning. I'm working on brushing your teeth and getting dressed, right? And then once they get that task accomplished, you move on. But you can use it all with this. And if you can teach kids just to be curious and open through verbalizing nonverbal, it really helps. But even for an adult, for you yourself to stay open. If you've heard it more than once or twice and it's a criticism, don't get your back up. Just go, you know what, there's probably something real in that. Let's just look at it. Let's not get defensive about it. Maybe I can learn something from it. And when you change that perspective and that reframe as an adult, all of a sudden your coping gets much better. So incorporating mindfulness, I usually have my ADHD adults. Kids find this harder, but we build it in usually with anxiety more than anything. But you take time to reflect on your day. At nighttime especially, you take 3 huge deep breaths. You're lying in your bed, you can do tension and relaxation, but you think of 3 really positive, amazing things that happened that you got, like 3 priorities that maybe you really wanted done, and you got almost all of them completed. And you can feel good about yourself. So when you're going to bed, we try and get people to reflect on their day and pick all the positive. In the morning when they get up, take those deep breaths again, and the thought is, I can do it. I'll stay on task. I'll stay to my priorities. I'll follow my organization. And up you go and out. And then use it for tasks. The deep breath really helps. If you do like yoga, the meditation really helps. If anyone's done some of the meditation or the deep breathing, there's usually a change in your whole body. It's like a runner's high too. If anyone's been really full on with athletics, it's that same, it actually changes your serotonin levels and it changes how you can attempt. A lot of our medications that use on dopamine and norepinephrine change our serotonin levels in our brain. And so deep breathing, meditation, exercise also do the same things. But you can't sustain it as long as medications, right? So you have to constantly do it. But for most ADHD, they can manage twice a day. If you can build one in at noon, I say go for it. Your perspective you hold is really important. I believe that all behavior is just coping. I don't think it's bad. I think there's some that's maladjusted, it's not working well. But behavior is just coping. And so when someone takes your head off, it's usually they've had a bad day, they're insecure, something's fueling it. I don't believe many people are born bad. I think it's just they're trying to cope. And if you have that belief, it really changes when your child is taking your head off, or a boss is taking your head off, or you're losing it. If you have that belief that you're just trying to cope, then you can change your perspective to deal with it. One of the best things I saw in the paper was this 80-year-old woman who was known as a miserable crank all her life. And it was her daughter writing this, and it was an obituary. And she said when her mom was about 65 and she had some ailing health, she decided to change how she approached to life because she couldn't change anything else. And the day she decided her approach, her perspective was going to change, life changed. And that's what happens with behavior. No longer was she complaining about aches and groans, she'd get up and go. It doesn't matter if I hurt, it doesn't matter if I go five steps, I've gone. And she stopped complaining, people were more open to her. And so I think a real open perspective helps anyone cope in life. It's changing that negative loop to positive, positive, positive. When we do this reframing that I talked about earlier, that mindfulness, sometimes there's stuff in there you don't want to see that just comes in because it's bugging you. So you've acted out, you've been mean to a kid, you've been mean to your boss, or you're overwhelmed because you can't do your work. And when that happens, think about it and then reframe it. Reframe it to a positive. And you can't go to bed until you've turned it to a positive. But what happens then is it's empowered you to actually do something about it instead of just worrying about it or getting caught in that negative loop. So positive, positive, positive always works. Practice forgiveness, reframe your thoughts. If there are challenges, know there are a deficit in skills. It's challenges, you're going to try and do what you can do. If you can't do it, it's because you don't have that skill development. As an adult, we can learn strategies, but it's hard for us, let's say an adult parent is trying to teach their children, it's often a bit chaotic and hard to give them that skill. So you have to be patient with it. One of the things for triggers with perspective is whose problem is it? So this is really, really handy, and it really changes how you react or what you worry about. I'll use my husband because I love using my husband for examples. On Sunday, he didn't know I was up all night with a kid that was sick. And we had a whole bunch of things we had to do, but I didn't get up to 10. And he was up, probably slept in, was up at 7. We had all this stuff to do, and I came in, I had my cup of coffee. I'm in a fog. I'm in a complete fog. And I'm sitting down having my coffee, and I'm doing a Sudoku. And it's a kind of advanced Sudoku, so he knows it's going to be an hour. I have no idea it's 10, so I'm thinking, oh, it's 8:39. And so he's looking at this going, it's going to be 11 if she's done doing this, and we have all this stuff to do. And I'm going to kill her. So that's what he's thinking. And I could tell he doesn't say that at all. He says, oh, what are you doing? I'm going to do the Sudoku, just have some coffee, had a rough night. Well, yeah, you weren't, I woke up at 3, you were in bed. Yeah, no, one of the kids is sick. Oh, okay, that was fine. He's, hold on. He's fussing around the table. Oh, he's going to drive me crazy. I just want to have a cup of coffee. And he's looking at me, he's going, we should get going, we got stuff to do. Yeah, you're right. And I'm thinking, I can fight this, and I can see he's just going to lose it, because he's been probably waiting for me for 3 hours, and his self-loop has been pretty negative about how he's working hard and doing everything in the family. And I know this, so I thought, oh, I'm not going to feel it. I'll have my coffee a bit later, have half a cup of coffee, and we start doing stuff. But it was enough to get him going. And I was starting to get triggered. And I thought, okay, whose problem is it? A is an adult problem, B is a both problem, C is a child problem, or the other one is ABO. It's A is adult problem, B is a both problem, and the other is whoever it is. In this case, it's my husband. So I'm looking at this going, is this my problem? He's trying to make it my problem, for sure, but it's really not my problem. I'll get stuff done. He goes to bed at 10, I can stay up till 2. I'll get this done. We're just different schedules. So it's really his problem. Okay, if it's his problem, I don't need to react. It's clearly his problem. I'm not going to let him make it my problem. It's his problem. And so what happens then is when he's at me and kind of pushing my buttons, I just start laughing. I'm going, whoa, you're in a negative loop. And he starts laughing. He's got a great sense of humor. He goes, I said, you're I called it an 8-track because he's an old guy. He thought it was funny, but I'm an MP3 guy. So we did this whole thing. But it diffused everything. Another example is a child with their laundry isn't done. And you have a system with this laundry that if you put it in the basket, it gets done. Kid comes to you yelling, screaming at you, where's my hoodie? I don't know, where is your hoodie? My immediate reaction is I'm getting yelled at and screamed at. I want to yell and scream at back. But is it my problem? No. Do I care if she has a hoodie? No. So then I can be empathetic. Then I can say, what's up? This hoodie's a big deal. I'm not getting triggered. I can actually explore what the issue is, and we can problem solve. So it turns out she wants to wear a hoodie with everyone else, doesn't have one because it's dirty. We review the rules about laundry, and do they need to be changed? That's so sad. Can I get you to this dirty hoodie that no one will notice is dirty? We can spot this. So you've come to problem solution. Instead of getting mad about someone yelling at you, you've actually explored it, but you haven't got triggered because you knew it wasn't your problem. When it's a both problem, then you have to sit down and say, I've got to communicate to get this solved. And that's what this slide's about. ALIVE is something I love. It's an acronym for asking questions, listening to verbal, nonverbal, iMessages, validating emotions, and expression, or watching your tone. Again, I'll use my husband because this is one of my favorite ones. My husband came in. I had been really bad. I'd done nothing all day. I'd been lying on the couch. By the time he came in, it was 5. There's no dinner, no laundry done. I've been studying, and I'm having a glass of wine. But I'm in a really good mood. And he's coming in, and I can hear this, you. And I've also thrown all the laundry out onto the the driveway because he's not picking things up, and and I'm a bit playful sometimes. Sorry. So he's had a really tough day. He comes in and sees all his laundry there, doesn't pick it up, and he's pretty angry. So he comes in, you. And I'm looking at him and saying, I'm learning about communication today. And I've learned about this alive thing. Did you know that you statements are fighting statements? And it's what we do when we're triggered. It's you did this, you did that. But, you know, I think that's an I statement, that's the I and the alive, that you've had a really tough day and that you just need to go for a run. And I validated how you're feeling. That's the V. And he's looking at me, and he's got this face, and he just walks away. And I've been playful in this whole bit, and he comes in, he's running in his running gear. And he goes, I really hate you. That's a nice statement.
I really do.
And you're completely right. And he walked out the door. And so you can use, when you communicate, you can use sense of humor, all that stuff, but it's really important to use I statements. I find when I'm angry, if you get angry at someone, all of a sudden you start accusing them. If you accuse them, people get their back up or they feel bad, right? So if you can follow that type of communication with anyone, it really works. My husband again starts laughing at me because, oh, please don't, I'll have done something that I shouldn't have done and upset him. And he'll look at me and he'll go, you know, why did you do that? I'm like, I'm so sorry. I didn't mean to hurt your feelings. It wasn't my intent. And she just goes, it's so counselor, but it's true. I didn't mean to hurt his feelings. That was the outcome. I've upset him. And I didn't mean to do that. And that's part of the communication, is you don't always have to apologize. You can take your stance, but you can apologize for hurting someone's feelings, for sure, right? Because that's usually what happens. One of the ways when we are getting triggered, when communication's hard and we're in that negative loop, is you stop yourself. You get that big stop sign there, and you start doing a 4-to-1 ratio of positive. So, it's a good example for like an adult. I'll use my child. She was really beating herself up. She didn't know about a chemistry test that she had. She was very flustered. She had to go write the chemistry. It was, I think, third year level. She's really good in chemistry. She's like a pro in chemistry. She hates chemistry, but she gets like 92%. She's wild in it. So she wasn't too worried, but she was flustered. So she answered 75 questions out of 100. She didn't turn it over. So she missed 25 questions. And so she got her mark back at 72. So she was doing this whole negative cycle, how stupid I am, and I'm supposed to be smart and I can't even do a test. And she was really getting bad on herself. And she goes, no, I'm smart, I do really well. This is one test. So you've got 2 positives. This is one test only worth such a percentage. The professor knows me and likes me. That really helps a lot. And the redirection is I can move on, or I can start taking steps to help myself get organized more so I don't miss exams. So she's thought of 3 positive things or 4 positive things before she's gone to the real meat of the problem. In her case, because the professor did love her, she actually got an email before she'd even gone in to come in and take the 25 questions orally. So, and she got a really good mark even without it, but she's a small university and they were really accommodating for her. With kids, let's say a kid jumping on a bed, we're looking at younger kids, or a kid telling you off. That's a really good one, a kid telling you to F off. You've got a teenager, you're tired of it, and you stop and you ask, like, what's up? You don't normally do this. This is out of character. What's up? That's an I question, or I've noticed you're really upset today. I don't know why. As far as I know, I don't think I've done anything to upset you. I think I did that with with Kira, the middle one. And she broke out into tears. My first reaction when she did that was, go to your room, we'll figure it out later, but you need to leave because I want to beat you. My temper was coming out. But instead I was teaching at the time parenting courses, so I used the Alive. And I used the Alive, and she broke out into tears, and we found out she was getting severely bullied. It had nothing to do with me, but it was an outlet. It was the last thing she could look at, is because she didn't pick up her clothes. I mean, that's not real life, Mom, So, but I used the Alive, and it did well. The praise and encouragement models, we'll get into a little bit. Encouragement and praise are very different and they give different meanings. But you need both of them when you're communicating with anyone. Provide feedback immediately. Immediately is super, super important, especially with an ADHD person of any age. If you don't give immediate feedback, but give it a week later, sometimes you've lost that momentum, you've lost that positive energy, and their self-esteem is probably still low anyway, and they need that really quick reinforcement just to build them up to keep on going. When you're looking at rewards and consequences aren't just for kids. I myself will, if I get everything done, my relaxation time is my reward. There's always so much to do in our household. If I don't get everything, I'll go down and do laundry. But if I've done everything I needed for that day, I'll sit down, watch a favorite show, read a book, and have a glass of wine. So that's my reward. For kids, it could be they're working towards getting an iPhone, they're working towards music lessons, they're working towards more points. Like loads of people go on a point system. I find ADHD and point systems don't work very well. Usually the parents can't keep it up because there's a little bit of ADHD in there. And also the kids get bored really fast. I had one ADHD mom who did a reward and consequence jar. They all sat down, had a family meeting. The kids thought up the rewards. They put them on pieces of paper in a jar. Consequences, kids thought up the consequences, put them in. And so when something, and they didn't use it all the time. It was like when stuff was really bad. But one of the consequences was picking up the dog poop. So no one wanted to pick up the dog poop. And so they loved it because the rewards would be pizza, whatever. You know, you did awesome, go grab a reward, put it up, and we'll, we'll do it on Friday. And the consequences, often all she had to say is, think about what you're doing, take a moment if you're having a time, because I don't want to give you a consequence. And picking up that dog poop, which they generated, was enough to change their behavior. So you can use rewards and consequences creatively, but they do help. You model your behavior. So again, that's respect to self, others. If you can't model for your children, that's how most children learn. And the classic is, I remember my mom telling me this story. My mom used to have this, my mom doesn't swear, but she had a litany when she was a young adult that she used to, I think it was shit, damn, bugger, something else, right? And it was a whole combination. She'd be stamping her foot. And it was always when no one was around. But Eileen, my oldest sister, was about 3. And something happened, and she saw Eileen cross her arms and stamp like this and mutter all this stuff, and went, oh, that's gotta stop. And that's how we learn, is we model behavior. So when you're coming in to apologize for losing it, let's say with your kid, and it might have been deserved that you lost it with your kid, but you're apologizing. And you're apologizing because you did not mean to lose it. That wasn't your intent, again, that word, when you went in there to try and talk about something. You got triggered and you lost it. Everyone makes mistakes, everyone gets triggered, and you get triggered as an adult, you get triggered as in relationships, and you get triggered in parenting. But it's what you do with it, like that Adler expression when you're coming in. And so it's what you do with it. If you model that you can say sorry, and that you can move forward, it's the best thing in the world. Because your child will do that to them. They're not frightened to say, I was wrong, let's move forward, how can we make it correct? But you have to model it. And same with team building. In the workforce, I can't say we're a good cohesive team when I'm taking all the glory for my team's work. Right? I'm modeling selfishness, protectiveness of work, not an open mind. That's not going to give a good team. They're all going to do the same thing. You're going to get tired of it. Right? So just really be careful when you're looking at communication. Sorry, I'm really chatting a lot. So went through a lot. The encouragement is an area of where you encourage, you ask questions, you promote what you want. Praise is like the cheerleading. If you do too much of the cheerleading, what happens if you do too much of the cheerleading is it sends a different message. You have to meet these expectations before I'm your cheerleader. Right? It doesn't reinforce that you can do it and build from that. So that's the difference between those. Development of skill acquisition, start with one behavior, we've talked about that, and keep on developing it. And even in adults you can. If you're disorganized, come up with an organization system. When we look at parenting strategies for behavior change, We said pick one problem, offer choices, direct behavior, change your entire environment. Sometimes you have to ignore the outburst. They want you to go with the outburst so that they don't have to do the behavior. So if it's not life-threatening, you can ignore it and just move on. You're still expecting the behavior to come, but you're not getting caught in that struggle. Don't fight with an oppositional person of any type, you won't win. You have to go kind of around them. Know your priorities, pick your battles. Stay firm once you do want to modify behavior for yourself, for your child. Know that it's going to take a while and use that mindfulness to stay on it. Like one of my tasks was my webpage, because it did take me quite a while. And I realized I was just not chunking material down. So I got it down in 30-minute chunks, and then I could be mindful and off I go. And I got it done in 3 days when I'd been sitting on it for a year. So it was a change of, I just realized what I was doing and I had to change it, right? Be clear and concrete with the problem. Loads of times we'll say the problem is Johnny's not picking up, Johnny's not doing this, Johnny's not doing that. And we get into Johnny's not brushing his teeth. But the real problem is compliance. And if it's compliance, you do something completely different than trying to get them to brush their teeth. They know how to brush their teeth. They brush their teeth at grandma's. But they're not brushing their teeth in your house. And maybe it's because you're walking away, not standing there, waiting them for do it. Because all they've learned then is that it's taken them 15 minutes to do a task when it should have been 3. And when you left, they went, oh, I've got 15 minutes, I can do whatever I want now. So that's how it works with behavior. Rewards we talked about, consequences we've talked about. When we're looking at transition of power, this is really important. When they're little kids, it's 90% you have control. When they're in their teens, or when they're young teens, like preteens, 60% to about 40%. But once they hit grade 10, sometimes even earlier, depending what the kids get into, because some of our kids are real risk takers, and you have 10%. And if you're not willing to negotiate or change how you deal with your child, you're going to have more problems, way, way more problems. So if you have that awareness, you can start building them out that you have no control. It's scary for a parent. But that's why the communication is so open. Because if you can't look at it clearly with a power control, you're going to be using little child strategies and techniques that aren't going to work. The teenager will just say, forget it, lie to you, and off they go, or you don't see them for 4 days. So you really need to know that they have some choices, you need to contain them, but you can't just demand, this is it. You have to negotiate. This is what I want, this is what you want, we need to find the middle path. So when we were talking very quickly about that comorbidity. We see untreated anxiety, depressions, and addictions, using all that reframing, using the self-talk, the mindfulness. Morita therapy is this therapy of getting in your head, planning what you're doing, and do it. They used it for anxiety. It was one of the first ones in Japan. It was very, very good for anxiety. With anxiety, you have to track your thoughts. You have that negative loop quite often going, like what if, what if, what if. You can't stop the what if. Or you start getting a little bit paranoid, maybe about bugs, whatever. So you have to trap it. You think of big stop signs, whatever's going to work, and you trap it and schedule a time to worry about it. And what happens is all of a sudden you're aware of it, and you start to worry less. I tell my ADHD kids that they have to worry for 20 minutes, and they usually can only do 3. It's really hard. Someone with a real anxiety disorder can usually do 10. But if the ADHD and anxiety, it gets too boring. It's hard to do. But they do learn to trap it and move on. Any adherence to schedules for sleep, nutrition, and exercise really help. Again, I talked about the serotonin levels with the changes. Sleep, dysregulated patterns, sleep hygiene is essential. Screen time is essential. So no screen time 1 hour before bed. That's TV or computer. Computer, I say 2 hours before bed, especially for the ADHD brain, because you get wired up, you get excited, and you cannot sleep. Often my adult ADHD guys have been procrastinating. By the time they sit down, it's 11 o'clock to do a task that they're supposed to do. They've got a deadline, they're up to 4 o'clock, and their sleep schedule gets so thrown out. Anyone here know melatonin? Melatonin is lovely. It really helps sleep disorders. Some people it doesn't work on, and that's usually if they've got some anxiety going too. But melatonin 5, in our sleep study, we did up to 20 milligrams. And whatever you don't use, you just excrete. It's like a vitamin C. You have to take it half an hour before bedtime. The trick is to get into bed, because if you stay up, it won't work. So you need to take it, get into bed, read, lights out half an hour. And most people, when it starts to really work, they don't even get through there. In our sleep study, some kids took 2 months. So we're almost through. I know I'm going very fast right now. For nutrition, again, tapas-like foods are best. Have your table set before you get the kids to sit down or anyone to sit down. Often that preparatory stuff beforehand is enough to take away that ability for kids sometimes to sit. For adults, often they haven't regulated their time, and so they're on the run and they'll go grab the quick burger. So if you have 5 or 6 opportunities, snack foods in the fridge, just take a little bit of prep to help. Planning leads to less junk food, and also there's something about the tapas style for people that have eating disorders too that's more friendly. Some people with anxiety, it's not a true eating disorder, but anxiety and ADHD plus the meds, sometimes that they're on, they don't have an appetite suppression. They can sort of get a little bit of an anorexia type feeling, and you have to watch it. But if you have tapas-like food, you get enough of little food opportunities to get your requirements, and you don't get that binge eating when the meds are gone, which often happens. To introduce new food, 20 to 30 food tests. So always have a rule that you have to try it. You don't have to eat it, but you have to try it, because maybe on the 10th time they love it. And organization, that's the big one. Calendarize your day, schedule your day. Always have a little to-do book with you, no matter what. Calendars can be printed, like a calendar, you know, like an agenda book, or they can be on the phone. A lot of my tech guys like the phone, but my most tech guy actually went to a week at a glance because it was bigger and he could do it better. So he carries both and uses his phone for appointments and tasks. He has the agenda to actually plan out his day, and then he has the to-do book that he carries around everywhere, which is his mind. He puts in appointments, he puts in telephone numbers, he puts in conversation, he puts in thoughts. Puts in tests, like that chemistry test would have been really good for my daughter. You can also set up 3 priorities for that day to do. For ADHD, that's a really important task to learn, is prioritization, because we often don't do that. With ADHD, you actually do the fun stuff first and get into a lot of trouble that way. So if you have priorities and you at least do 3, you'll get used to, your behavior will start changing. 15-minute tidies. If you go to flylady.com, there's don't sign up, you'll get far too many emails, but the principle is that you kind of section your house off. They use it for houses. It came about with depression, actually, with people just not doing well. You section your house. So this week we're doing the kitchen, and you have 15-minute tidies 3 times a day where you just clean that area and get it all sorted out. But you can do 15-minute tidies with anything, and 15 minutes is really ADHD friendly. So you've got downtime. ADHD people don't like downtime. Use 15 minutes to organize your electronic file. Because most people with ADHD have an inbox that's wild, or else they've deleted it and lost it. So you learn how to use these 15-minute tidies, and they can go anywhere. You can use a 15-minute tidy for the house, for laundry, for work. Tasks are best done in 30-minute intervals. Again, you're chunking it down small. Instead of I'm doing the website, I'm doing my interview. I'm doing my introduction. Right? So it's not so overwhelming. It's manageable. I can do that in 30 minutes. And then I can start working. Let's say I have 5 hours. I've got, 10 tasks I'm going to get done if I'm on 30 minutes. And it also feels good. So for my web page, as I said, 3 years instead of 3 days instead of 1 year, by just chunking down that minutes. And 30 minutes, sometimes if you set a timer and it goes off, it's enough to go, oh, change tasks, off I go. Change focus helps, keeps you going, keeps you regulated for your attention. For adults, after 2 hours, take a break no matter what. Often what happens is you get hyper-focused and you're there for 5 hours, and then you're so depleted you don't look at it again for a week, and you're missing your deadlines again. So after 2 hours, always have your break, and it teaches you regulation. And I'm going to wind up. Addictions is something in itself. I talked about computers. Keep your time down to an hour. If you can, if you're on a computer, I love the Froggy game. I can spend it for 5 hours on the Froggy game. It's a stupid game for grade 8 boys, or 8-year-old boys. But it's fun, it's completely mindless, and I love it. My kids now are coming in, Mom, you need to get off the computer. It's really cute. But if you need to keep it down to an hour, that's it, if you're doing any type of games. For youth, I would tie it to homework. You've put in 30 minutes, you get 30 minutes. So it's like a job. I'm not going to get paid if I don't work. So it teaches them a little bit of that regulations. So stress reduction, we're down to the last little bit. Manage your stress, take time for yourself, work out, exercise, huge. I take my time at the end of the day because that's when everyone's in bed and it's quiet, and I find it very replenishing and I love it. And remember in life, that skill development is a process that grows with time and practice. It doesn't matter what age you are with ADHD. If you're consistent and persistent, it will happen. So if you're working on your child's behavior or your behavior or a task, stay true until it's done. Focus on 1 or 2 goals at a time. Know that you're going to mess up. Be aware and make a plan when they occur. And don't beat yourself up. Self-esteem and anxiety don't help. And we're all human, make mistakes, and be more than anything, be kind to yourself and anyone else. Kindness goes a long way. I had a clerk telling a lady off. I don't know what happened, I have no idea. And I came up and I said, oh wow, you have nice earrings. And first of all, she was slamming my stuff through. And as soon as I said, you have nice earrings, it's kind of a Carol Burnett thing. She used to use this all the time. And what happens is she just smiled. And her life changed for that day. So that didn't take me any time. I didn't like her earrings, but that doesn't matter. Actually, I did. I'm being bad. And actually, the last thing is smell the flowers. That's mindfulness. Take time. Enjoy your day. So sorry I got going there. Any questions?